My name is Dr. Kimberly Brady. I work here at Roswell Park Cancer Institute. I am a Mohs surgeon and a dermatologic surgeon. I grew up in the Buffalo area. I went to school at Stony Brook University for undergrad, and then I went to medical school at the University of Rochester. And there I stayed for my internship and did my dermatology residency training there as well. And then I went on to specialize in Mohs surgery and cutaneous oncology, and I did that fellowship at Washington University in St. Louis. I worked there for a little bit, and then I headed back to Buffalo, New York, where I started my job here at Roswell Park. Ever since I was little, I always knew that I wanted to be a doctor. I didn't know exactly what I wanted to do, but I knew that somehow I wanted to take care of people. So I kind of went through all the steps, went to medical school, and it probably wasn't until I was a third-year medical student when we start doing our clinical rotations that I realized that being a dermatologist, being a Mohs surgeon is what I wanted to do. I spent a couple days shadowing one of the Mohs surgeons at my medical school, who's now a close mentor of mine still. And when I saw him doing what he did, I thought to myself, this is it. This is what I want to do for the rest of my life. And that the rest is kind of history, I guess, from there. So mostly what we do on a day-to-day basis is we remove skin cancer. Most of the Mohs surgery cases that we do are on the head and neck. What we have to do after we remove the skin cancer, though, is we have to reconstruct the area. So that's kind of exciting and challenging because it's different in every single person. You can remove the exact same skin cancer on the exact same spot on someone's nose, and in two different people, you're going to reconstruct it differently, just because noses come in different shapes, they come in different sizes. Everybody's a little bit different, so you kind of have to look at the area and figure out what's going to look best on every individual patient. So I think that makes our day a little bit different and challenging. Even though we might be doing overall the same thing every day, still every day is kind of different because we have to be creative and figure out how we're going to reconstruct something after a skin cancer is removed. I love what I do because every day is different. I'm not sure what I'm going to counter every day that I come in. Some skin cancers are big, some skin cancers are small. Some of the facial reconstructions that we do are very standard, and others are also very complicated. And I think it's a challenge when you walk into a complicated case, trying to figure out what you're going to do that day to reconstruct a patient after you remove their skin cancer and have them looking great and knowing that in a year no one's going to know that they had surgery.